Good afternoon, everyone. Welcome and happy Wednesday. I'm so excited to welcome you to our next disease education webinar series installment. Um, I this session will be focused on pulmonary rehabilitation, which is a topic that I think is so important. I think it's great to hear about today. We have an expert in this area with us. I'm excited to welcome her. I'll introduce her in a moment. For those of you who have noticed, we do have a little bit of a different look to our webinar series today. Instead of the GoTo platform, we're now using a Zoom platform. And so as a result, I have a few housekeeping notes for us as we get started. Oh, actually, okay. So let me go back and introduce Aubree Carlson first before I give her housekeeping notes. I'm so sorry, Aubree. Dr. Aubree Carlson is joining us today. She's an assistant professor at the University of Nevada, Reno. She has a bachelor's degree in neuroscience and in nursing. She has a master's degree in a nursing educator track in nursing, and she received her PhD in nursing science last year. Having previously worked as a pulmonary rehabilitation nurse specialist, Aubree is really passionate about improving the quality of life in patients with chronic lung disease. And her research focuses on symptom science and health services research with an emphasis on the delivery of symptom management programs via telehealth to improve patient outcomes. I'm very excited that we'll be hearing from Aubree today, and I certainly welcome you to our webinar. So let me see, as we get started, this is our usual disclaimer that this is not personal medical advice, and for any questions you may have, we'd really like you to talk with your personal physician about those. Oops, let's see. Okay, let me go back. I don't have housekeeping pictures for you, but just as you're orienting yourself to the Zoom platform, I want you to look at your control panel, which is across the bottom of your screen. You'll see some of the same features we used to have, which includes a chat button that we'd like you to use if you have any technical questions or troubles there. And just send us a chat. Somebody from our staff will try and help you figure out what it is that's giving you trouble and help you to fix that. If you have questions about our topic today or for Dr. Carlson, then if you'll use the Q&A button on your control panel, that will allow us to see that as a question so that we can try to address as many of those questions as we're able to before the end of our session today. And then one new feature that we're really excited about is our captioning feature. If you'll go to the control panel, there's a button that says More and has 3 little dots on it. And if you'll click those dots, you'll see a drop-down menu that lists captions as one of the options. If you go to captions, there is an option to show captions, and you turn that on, just click that button, and this will live caption everything that we're saying and all of Dr. Carlson's comments today. You can also change the language if you're inclined to do so, and it will live translate as well. Please do not raise your hand in the session. I think there might be an option there to do that, but use our chat for any technical problems and Q&A. And then finally, in the chat function, we will drop a PDF of the slides that are being used today. So you can click that. You will need to download it before you're able to open that. But that should be coming up there where you can access that information. So after all of my housekeeping notes, thank you for your patience. Dr. Carlson, thank you for joining us, and we're excited to hear from you.
Thank you, Dr. Case, and thank you everyone so much for being here today. It's an honor to be here, and I would like to welcome everyone to today's disease education webinar series on pulmonary fibrosis and pulmonary rehabilitation, exercise education, and empowerment. As Dr. Case said, my name is Aubree Carlson. I'm faculty at the University of Nevada, Reno, and my program of research does focus on the delivery of self-management programs via telehealth for patients with pulmonary fibrosis. But prior to this faculty role, I worked as a pulmonary rehab nurse specialist. So I am very happy to have this opportunity to be here with you all today and share more about what an incredible resource pulmonary rehabilitation is, as well as highlight the importance of exercise maintenance for all patients with pulmonary fibrosis. I also have no disclosures to share for this presentation. And as Dr. Case covered with the medical disclaimer, this presentation is meant to be a general guide, and some suggestions may not be feasible or practical for everyone. So we want to emphasize that you please discuss your individual healthcare plan with your healthcare providers. There are 5 learning objectives for today's disease education webinar. The first is to understand the important role pulmonary rehabilitation can have in improving the lives of individuals with pulmonary fibrosis. The second is to identify the 3 essential components that encompass a pulmonary rehabilitation session. The third is to learn and implement one of the most important educational topics of pulmonary rehabilitation, and that's breathing exercises. The fourth learning objective is to recognize the importance of sustained exercise and daily breathing exercises to maintain exercise capacity and endurance. And the final learning objective is to identify virtual pulmonary rehabilitation resources to support patients. We will first begin with an overview of the evidence-based intervention of pulmonary rehabilitation. What is pulmonary rehabilitation? Pulmonary rehabilitation, or pulmonary rehab, or PR for short, is a supervised, evidence-based medical program that combines exercise and education to improve the lives of individuals with chronic lung disease. It is a multidisciplinary and comprehensive intervention that includes 3 essential components to improve lung health. The 3 components that make up a PR program are aerobic exercise, endurance training, and education. We will go into these in a bit more depth shortly. The duration of PR programs can vary, but typically pulmonary rehab consists of bi-weekly sessions over the course of 9 weeks, totaling 18 sessions to complete a program. And pulmonary rehab really provides a safe environment with a team of trained professionals, including a registered nurse, respiratory therapist, and exercise physiologist, who will monitor patients throughout the session and provide meaningful education that can improve daily life for patients with chronic lung disease, such as pulmonary fibrosis. Having worked in a PR program, I would frequently hear patients share how beneficial they found the program to be, but it's not just patients verbalizing the benefits of these programs. Pulmonary rehabilitation is an evidence-based intervention, meaning these programs have evidence to show that they are effective at producing results and improving outcomes. In patients with pulmonary fibrosis specifically, PR improves exercise tolerance, functional capacity, pulmonary function, dyspnea, which means shortness of breath, and quality of life. Additionally, pulmonary rehab provides a safe environment for individuals to come together as a community and share their experiences and work together, which can truly be an invaluable form of support. A study conducted by Dr. Diana Sanchez Ramirez specifically examined the impact of pulmonary rehab services at a large medical center in patients with different types of lung diseases. So these next slides are looking at various outcomes pre-post pulmonary rehab. And I put a green box with an arrow around the ILD and other restrictive lung diseases categories. So this bar graph here is looking at 6-minute walk test distance measured in meters, pre-pulmonary rehab and post-pulmonary rehab. I'm sure many of you are familiar with this, but a 6-minute walk test, in case this is new to anyone, is a standardized exercise test that measures aerobic capacity and endurance by measuring how far a patient can walk in 6 minutes. So looking at this box here with ILD patients, because as we know, pulmonary fibrosis is in that ILD umbrella, average 6-minute walk test distance increased from 294.1 meters pre-pulmonary rehab to 339.2 meters post-pulmonary rehab. So that's a 15.3% increase. Looking at the patient-reported outcome measure of fatigue now, ILD patients reported an average fatigue score of 3.2 pre-pulmonary rehab, and the average score decreased to 2.7 post-pulmonary rehab, which is a 15.6% decrease in fatigue score. Dyspnea, as a reminder, this means shortness of breath. While it was not a drastic decrease, it did decrease from an average score of 3 to 2.9 in patients with ILD when looking at pre-post pulmonary rehab. And finally, I want to highlight in this study that looked at self-efficacy pre-post pulmonary rehab. So this is assessing patients' confidence in performing activities to self-manage their chronic lung disease. This is really focusing on that empowerment piece that is included in today's webinar title. So looking at a patient's confidence in performing activities to self-manage their pulmonary fibrosis or other ILD, scores improved with an average pre-pulmonary rehab self-efficacy score of 6.4, increasing to a post-pulmonary rehab self-efficacy score of 6.9, which is a 7.8% increase. So you can see in varying degrees from these graphs, there were improvements in all outcome measures when comparing pre-pulmonary rehab to post-pulmonary rehab, which really further emphasizes that this is an established evidence-based intervention that can be instrumental in improving the lives of patients with chronic lung disease, such as pulmonary fibrosis. This figure I wanted to include, it was created by Vainshallboim et al., and it really just nicely summarizes the possible mechanisms for the beneficial effect of exercise training, for example, in the setting of pulmonary rehab, in patients with idiopathic pulmonary fibrosis specifically. So beginning on this left column, as we know, IPF results in varying physiological limitations, such as impaired gas exchange. And this is subsequently going to lead to decreased exercise capacity, decreased quality of life, and various symptoms such as dyspnea and cough. So when you implement exercise training, whether it be in a PR setting or alternative setting, this is going to impact numerous physiological adaptations, including the cardiovascular, respiratory, and musculoskeletal systems. With these adaptations, we can decrease symptoms, improve exercise capacity and quality of life, and thereby overall improve an individual's health status. Now that we have covered what pulmonary rehab is and all of its numerous clinical benefits, let's move on to the 3 essential components of a PR program, and that is aerobic exercise, strength training, and education. Each PR session will include these 3 activities: aerobic exercise, strength training, and education. Aerobic exercise encompasses the use of equipment such as a treadmill, stationary bike, or recumbent bike for approximately 30 minutes. That time can be modified based on varying factors. I want to point out that with aerobic exercise, the PR team will meet the patient where they are at. Many patients decline participation in a program due to fear and uncertainty of being able to complete the activities. And it's really important to remember that this intervention is patient-tailored. The PR team will start patients on an aerobic exercise equipment that is appropriate and safe for their level. A patient may come into the program and be really deconditioned starting out in the very first session. So the team will start them on something like an arm bike, sitting in a chair, pedaling an arm bike. But as the weeks progress and the patient makes advances in their endurance and exercise capacity, the PR team can identify if it's appropriate to advance the patient to a different form of aerobic exercise, such as a recumbent bike. And this is really one of the great things about the PR environment. You'll have a team of trained professionals who will be monitoring you and be able to identify when it's safe and appropriate to advance to a stationary bike, a treadmill, or increase your handheld weights for strength training. So speaking of strength training, in addition to aerobic exercise, each session will include a strength training component. And what this is it involves the use of handheld weights while sitting in a chair to perform varying strength training exercises. For example, bicep curls, tricep kickbacks, and balancing exercises are also typically practiced during strength training, as it's very important to prioritize balance and help prevent falls. So that's why balancing exercises are also included. And then lastly, important educational topics will be covered during a session in a group educational setting. And some of these topics will include managing your activities of daily living, nutrition, interpreting pulmonary function tests, and my personal favorite, breathing exercises to manage your shortness of breath. Breathing exercises are extremely important and are practiced at every single PR session, and I will highlight 2 breathing exercises shortly. A typical PR session looks a bit like this. So you can see in this top middle image, the patients are sitting in a chair, they are wearing their supplemental oxygen, and they are completing their strength training. This right here is an image of someone practicing balance. We practice balance standing behind a chair. This keeps it safe so that if you ever become off balance a bit, you can quickly grab that chair. For aerobic exercise here, we have an image of a treadmill. Here's a recumbent bike. Again, it's completely dependent on what is appropriate for the patient. And then lastly, you have your breathing exercises and group education sessions. I do want to highlight today breathing exercises, as this is a primary educational focus of pulmonary rehab. So anytime I have the opportunity to share this education, I like to do so. Breathing exercises is an all-encompassing term for a range of techniques that involve active expiration, slow and deep breathing, and body positioning. There are 2 primary breathing exercises that are taught in a PR program, and that is pursed lip and diaphragmatic breathing. Sometimes you'll hear diaphragmatic breathing referred to as belly breathing. These terms are interchangeable. Breathing exercises can reduce perceived dyspnea, and they do so through 3 mechanisms. This is documented in the literature. Breathing exercises increase the strength and endurance of the respiratory muscles. They optimize the pattern of thoracoabdominal motion, and they improve gas exchange. So what I want to do right now before I go over these exercises is have everyone on this webinar. I can't visualize you, but I want you to do it for yourself and sort of to check in with your own body and your own breathing. So go ahead and take a deep breath in and exhale. Okay, so think about the way that you we're just breathing as I begin to talk about this next component. So as we age and we experience stress and we change our body positioning, we have a loss of belly breathing. Now, what do I mean by belly breathing? We are all born knowing how to belly breathe, which simply means that we are using our diaphragm, which is the major muscle of respiration located between our thoracic and abdominal cavities, to breathe for us as we should be doing, instead of engaging all of these extra accessory muscles in our neck and shoulders to breathe for us. Think of a baby. When a baby is first born and they're lying on their back in their crib, and when they breathe, what do we see? Belly rise, belly fall. Belly rise, belly fall. You know what we don't see? When I tell my college students before an exam to take a deep breath and they all raise their shoulders up and use their upper bodies, and their shoulders come up to their earlobes as they take a deep breath in. So while we are all born knowing how to use our diaphragm and belly breathe, somewhere around the age of 5 or 6, we go to school and we start sitting a lot, and we begin to lose this ability. Instead, we incorporate our neck and our shoulder muscles, which are not meant for breathing. So the next time that you are thinking about your neck and shoulder pain being from all of the sitting and working at your desk that you've been doing, you may want to rethink that and check in with the way that you're breathing. The good news is that we can retrain our respiratory muscles to breathe properly, and this has been demonstrated to be learned in just 4 weeks when practiced daily for 10 minutes. So let's learn how to do these. Pursed lip breathing is very simple. It can be implemented anytime, anywhere. For pursed lip breathing, you breathe in slowly through your nose for approximately 2 seconds, and then exhale slowly through pursed lips for approximately 4 seconds. I always tell my patients, smell the roses, blow out the candles. Pursed lip breathing helps increase your oxygen saturation. It helps you regulate your breath, and it can prevent panic attacks. And it's always so wonderful to see the immediate response to pursed lip breathing in pulmonary rehab. We have patients wear their pulse oximeters as they exercise on the aerobic equipment so we can see their oxygen saturation. And if we see that their saturation is beginning to drop, we can prompt them and say, don't forget your pursed lip breathing. And the patient will start to implement that, smell the roses, blow out the candles, and we can visually see that oxygen saturation on the pulse oximeter slowly begin to increase. Now, diaphragmatic breathing, sometimes called belly breathing, is pursed lip breathing plus one extra component. And that component is that now you are paying particular attention to what your diaphragm is doing. As a reminder, your diaphragm is the major muscle of respiration that sits here between our chest and abdominal cavities. It sits directly below the lungs, and it is a large dome-shaped muscle that contracts rhythmically and continually. And when we inhale, the diaphragm contracts and flattens as our lungs fill with air like a balloon. When we exhale, our diaphragm relaxes and returns to its resting dome-shaped position. With diaphragmatic breathing, we want to belly breathe and engage our diaphragm in our breathing cycle. So with diaphragmatic breathing, just like pursed lip breathing, we will breathe in through our nose, and as we do this, our belly should expand and come out because our lungs are filling with air and our diaphragm is lowering. Then when we exhale through our pursed lips, like we're blowing out a candle, our lungs empty the air out, our diaphragm rises and returns to its normal resting position, and our belly contracts back in. I like to tell my patients when they are practicing this to place one hand on your chest and one hand on your abdomen. The hand on your abdomen should be the hand that is moving, and the hand on your chest should stay completely still. So that hand that's on your abdomen should come out as you're breathing in through your nose, and then it should come back into a resting position as you exhale. If you feel that hand on your chest moving, it's a reminder to do a reset, check back in with yourself, because you're not truly engaging your diaphragm in the breathing cycle. Lastly, a great way to practice belly breathing, diaphragmatic breathing when you first begin is to lie flat on your back in bed with one hand on your chest, one hand on your abdomen, because lying flat really helps you to better engage your diaphragm as opposed to your neck and shoulder muscles. And you can also visualize your abdomen rising as your lungs are filling with air, and then visualize your abdomen returning to a comfortable resting position upon exhale. So what can we do about breathing exercises? Well, according to the American Lung Association, breathing exercises should be practiced 10 minutes daily. This is 10 minutes total of pursed lip and diaphragmatic breathing, not 10 minutes of pursed lip, 10 minutes of diaphragmatic. And what this will do is it will help us maintain our ability to engage our diaphragm and manage dyspnea. Breathing exercises also really helps us become aware of our breath. Breathing is such an autonomic process, and we take it for granted until all of a sudden, one day, it becomes really difficult. Awareness of your breath can help you become more mindful of when you're beginning to feel short of breath, and help you monitor which activities cause shortness of breath, thereby allowing you to easily implement your 2 breathing exercises. Now, what happens when you complete a pulmonary rehab program? Where do you go from here? It is imperative that patients maintain their gains. Do not lose everything that you worked for during those 18 sessions by discontinuing your 30 minutes of aerobic exercise, your daily breathing exercises, or your strength training. The pulmonary rehab team wants you to establish an exercise routine that you can maintain outside of the program. The team will develop a home exercise program for you to follow. Consistency and commitment are imperative to maintain all that you'll accomplish in a PR program. When patients complete a PR program and continue to exercise, they have improved outcomes. This is documented in the literature that when they continue to exercise, they'll have improved endurance, a higher quality of life, and reduced respiratory-related hospitalizations. So I want to strongly emphasize the importance of working with the PR team to identify an exercise plan upon completion of the program that you can maintain. It may be exercising in your home, and if that's the case, we want to make sure that you have the necessary equipment. Additionally, your local PR program may offer a maintenance program. What these are is you can continue coming to the facility outside of normal class hours and use their equipment. The PR maintenance programs are an excellent resource, but not offered at all programs. So you'll have to check with your local program to confirm that. But above all, we want to identify a plan for success for you to maintain all the gains that you accomplished in PR by continuing your aerobic exercise, strength training, and breathing exercises. And finally, before I move on to the final portion of this webinar talking about virtual resources, I want to revisit the title of today's webinar, which is Pulmonary Fibrosis and Pulmonary Rehabilitation, Exercise, Education, and Empowerment. While we have talked about exercise and education, I want to highlight the empowerment piece that comes with completing a pulmonary rehabilitation program. When patients are newly diagnosed with a chronic lung disease like pulmonary fibrosis, it is a major life stressor that can impact not just the physical domains of life, but also mental and spiritual domains. Remember what I said about breathing being such an autonomic process that we don't really think about it until it becomes difficult? Well, this can align with physical abilities as well. With a chronic lung disease like pulmonary fibrosis, patients start to experience physical limitations, which doesn't necessarily encourage the patient to want to exercise. And so they stop altogether, which will only negatively impact overall health and quality of life. Pulmonary rehab teaches patients that it is safe to exercise, how to exercise safely, and overall empower patients living with chronic lung disease. There are a few virtual resources that I would also like to cover. Firstly, the American Association of Cardiovascular and Pulmonary Rehabilitation, or AACVPR, has a list of PR programs, and you can go to their website at aacvpr.org/program directory to find a PR program near you. The Pulmonary Fibrosis Foundation, or PFF, has a pulmonary rehabilitation toolkit that provides asynchronous modules, meaning patients can work through the modules at their own pace. And I want to acknowledge that many times there are barriers to accessing a PR program, whether it be access to a nearby program. Sometimes patients have to drive over an hour, and that can be extremely limiting. Or sometimes there's issues with insurance coverage. And so because of these barriers, fortunately, the PFF has partnered with AACVPR to develop a virtual pulmonary rehab toolkit for pulmonary fibrosis patients specifically. This toolkit includes 8 modules with exercise training and disease education, and exercise videos are offered at 3 different levels: beginner, intermediate, and advanced. This is an excellent resource, and you can go to the PFF homepage and type in Pulmonary Rehabilitation Toolkit into the search bar to access this. And finally, if you ever need a refresher on pursed lip or diaphragmatic breathing exercises, the American Lung Association has video demonstrations of these breathing exercises that you can view. Here are my references. I want to thank you all so very much for your time today, and I look forward to any questions you may have. On this next slide as well, you can also find my contact information should you have any questions or like to continue the conversation about pulmonary rehab further. Thank you so much.
Thank you so much for that wonderful presentation. I made some notes myself. That was great. And we do have some great questions from our audience. Just as a reminder, since we're on this new platform, if you would like to ask any questions of Dr. Carlson, we have the Q&A button on your control panel, which should be located at the bottom of your screen. And you can send those questions in. We have a lot, but we'll get to as many as we can while we're talking here. So I will start with one I think is an interesting one that even I come up with as a physician when I'm seeing patients in clinic. Patients don't have a lot of breathing issues or coughing symptoms. They feel, maybe they're early in their disease. They don't have a symptom burden. What would your suggestion be in terms of relative to, number one, activity level, but also specific to pulmonary rehabilitation?
I love this question. Thank you, Dr. Case, and thank you to who asked that. What I want to say about this topic is earlier intervention equals better outcomes. Rather than delay and wait to establish an exercise program until you are more advanced in the disease process, you will have better outcomes the earlier that you initiate an exercise regimen. Now, the barrier with this in regard to starting a pulmonary rehab program specifically is insurance coverage. Unfortunately, under Medicare guidelines, pulmonary rehabilitation services are covered based on pulmonary function test numbers. And so looking at PFTs, a patient has to qualify for coverage based on certain numbers in PFTs. So with our COPD patients, we're looking at FEV1, FVC. With our pulmonary fibrosis patients, we're looking at TLC and DLCO. And they have to be in a more moderate stage of their disease process for the pulmonary rehabilitation service to be covered. As soon as it is covered for you and you are qualified, I would strongly encourage that you attend the PR program. The earlier you attend, the better, because you're going to get these really great resources early on that you can thus continue on throughout your disease trajectory. But if you're one of those people who doesn't qualify for PR just yet, then I would say utilize the PFF Pulmonary Rehab Toolkit so that you can start to get an introduction into these exercises and implement them from home.
I think that's great advice. Um, we've got so many other questions. They're still coming in, so I'm going to get on with the next one. But I think that's really great advice for people. It may be that that people aren't feeling very many symptoms because their level of activity isn't what it potentially could be. And I find that as people don't even realize what's happening, but they start to curtail their activity level not to be experiencing shortness of breath or limitations. And so I think thinking about those issues early and getting into some sort of exercise regimen is great advice. We have a good question. You showed some lovely data on the impact of pulmonary rehabilitation. Can you speak to whether there would be any expected impact on pulmonary function parameters, DLCO, forced vital capacity, that sort of thing?
Yes, the data on this is varied, where some people experience slight improvements on their PFTs. One of the improvements that we do tend to see is related directly to breathing exercises and the implementation of those, because by strengthening the diaphragm muscle, they complete pulmonary rehab, go back and repeat a PFT, and they really have an improvement in their forced vital capacity because they've strengthened that muscle and they have been practicing their daily breathing exercises. And so there are improvements in that sometimes, but the data overall, I would say, is varied to give a direct answer that if you complete a pulmonary rehab program, no matter what, we'll see an improvement in TLC or DLCO, it's just not saturated enough to give a good direct answer on that just yet.
That's great. That's a good update. Thank you so much. All right, let me see. I have another question. If you could talk a little bit about the importance of strength training. I find that this is something that people don't necessarily think about because maybe they're more symptomatic when they're walking or climbing stairs or doing more aerobic activities. But I wonder if you could talk a little bit about that complementary piece of strength training and how important that is, and the importance of muscle mass and maintaining the conditioning of the muscles.
Yes, thank you, Dr. Case, for highlighting that because that is so important. So the aerobic exercise, I think, gets heavily emphasized for people because we are so focused on the cardiovascular component. That's what we tend to think of when we think of exercise, is things like walking, riding a bike, etc. And those are great. They're wonderful activities for endurance, but we also need to incorporate strength training because as we age, And as we become deconditioned with chronic illnesses, we begin to lose muscle mass. And if we begin to lose our muscle mass, we will be weaker when it comes to participating in our activities of daily living. And we may be at an increased risk, should we ever have a fall, to subsequently have a fracture. And so by strength training, we're going to help build our muscle mass and endurance. And the endurance piece, when you have pulmonary fibrosis and you're required to eventually potentially be on supplemental oxygen, and now you're responsible for carrying an e-cylinder or a portable oxygen concentrator, that requires strength. It requires upper body strength. And so the strength training piece is important so that you can maintain your ability to be independent, be high functioning in your activities of daily living. And the other piece that is really great for strength training with pulmonary rehab is you'll learn with the breathing exercises when you should be breathing in and when you should be breathing out. We always emphasize breathe out on the hard part, breathe out on the hard part. And patients will start to think of that. And when they're at home and they're reaching up or reaching down to pick something up or tie their shoes, they take a breath in, exhale, then bend down and tie their shoes. And those adjustments can make all the difference in their dyspnea and quality of life. And so it really just further emphasizes the comprehensive education and components that somebody will get from pulmonary rehab with the strength training, the aerobic exercise, and the education.
Thank you. That's really helpful. I would also just want to highlight something that you mentioned when you talked about the different components of pulmonary rehab. And that is, I think sometimes people think of strength training as a little intimidating. You kind of have that vision in your head of the buff person in the gym and, big weights and things like that. But you had on your slides, and you mentioned just, light weights. So, bands or 1, 2, 3, 4, 5-pound weights. And that's a lot more accessible to people, I think, than thinking about, the big deadlifts and like the big heavy weights and stuff like that can seem really intimidating.
Absolutely. We at the PR programs, there's a range of weights, and there's 1 pound, 2 pound weights, and just that repetitive rhythmic pattern of bicep curls and tricep kickbacks. It really helps to strengthen and can have such a difference when you're performing those activities about 3 times a week.
Yeah, that's awesome. Okay, so this is actually a really great question. What about some of the standards for pulmonary rehabilitation programs? Specific question here being whether a cardiopulmonary rehab program is the same as a pulmonary rehab program. Sometimes they're co-located, in some institutions they're separate. Can you talk a little bit about that?
I'm mostly familiar with the separate entities of cardiac rehab and pulmonary rehabilitation. AACVPR does accredit both programs. So the association of that I was talking about earlier, cardiovascular and pulmonary rehabilitation. And so they have their standards and metrics for being an accredited rehabilitation service, but I'm mostly familiar with the individualized pulmonary rehabilitation for patients with chronic lung disease, and then a separate cardiac rehabilitation for patients with various cardiac diseases. So I would recommend working with your healthcare provider to see which they feel would be most appropriate for you to participate in. They may say that because you are experiencing both cardiac and pulmonary diseases, that if there's a combined one that could encompass education from both sides, that would obviously be much more conducive for that patient population. So I would encourage the individual who asked that to identify what programs are around them, and then ask their healthcare provider after that.
I think that's great advice. Some of that is accessibility. It may be that there's a combined program that's within travel distance, and just talking with your healthcare provider about what's best for you. Can you talk a little bit about pulmonary rehab in the lead up to a lung transplant, either evaluation or listing or the actual transplant process?
I can speak to pulmonary rehab training prior to transplantation. We were fortunate enough to work with quite a few patients who were listed for lung transplantation. And at our program and the hospital where patients would subsequently go be transplanted, and I'm sure many people on this call are familiar, it is a requirement to be enrolled in pulmonary rehab in order to be listed on a transplant list. And so for those patients that we work with, we really encourage them to be very compliant with attending all of the sessions, practicing their exercises, breathing exercises outside of pulmonary rehab. We would tell them during the sessions, you're training for a transplant, you're training for a transplant. And we had people complete the program, then go home with their home exercise program and get transplanted after that. We had a patient who was in the middle of pulmonary rehab and got the call, there's a lung for you. And then they went and did a transplant and then came back to us so that we could get them back up to a good level of endurance and strength. But it's essential. It's absolutely essential in order to be listed and have a successful transplant. And there's one patient that I can think of who it was just one of the most meaningful experiences of my life, that this individual received a lung transplant and was extubated and up walking shortly after. And the patient had shared that the healthcare providers were just so impressed with her endurance and ability to get up and walking after that. And the patient said, it's because of pulmonary rehab. I was training for this lung. So yeah, it's just such a very, very special environment. But yes, it will be a requirement for you to be in a pulmonary rehab program in order to get transplanted. And if you finish the program before you receive your transplant, you have to maintain your gains. Remember that.
So important. It's not a one and done. So something that's sort of just always a work in progress, I think.
Yes.
Another question I was just looking to see if I could find. Can you talk a little bit about, I think lots of our patients may struggle with weight, both sides of being not at their ideal weight, either overweight or underweight. And I understand, there's potentially opportunities for nutrition education and activity and muscle building. Can you talk a little bit about how a pulmonary rehabilitation program might be helpful in somebody who's trying to deal with a weight, a non-ideal weight?
Yes, one of the points I know that I had emphasized for today's webinar is the importance of patient-tailored goals and outcomes in PR programs. And so prior to you beginning a PR program, you'll go in for an intake session with one of the healthcare providers. And in that session, not only will they identify goals, but they'll look at all of these pre-measures such as weight and other like dyspnea and other sort of patient-reported outcomes. And so with weight specifically, sometimes we have people who are at a BMI that's considered overweight or obese. And on the flip side, we have patients with BMIs who are underweight. It really just depends on so many factors such as their disease process, genetics, et cetera. And so with this patient-tailored aspect of pulmonary rehab, what we do is focus on the aerobic exercise piece And for patients who are underweight, we actually limit their time on the aerobic exercise equipment to about 20 minutes because the aerobic exercise will more likely lead to weight loss. And so we want to limit that to about 20 minutes. With patients who have a higher BMI and are interested in possibly losing weight, we would allow those patients to go over the typical 30 minutes on an aerobic equipment up to 45 minutes, depending on what they're capable of doing. So the tailoring of the time on aerobic exercise, in combination with the educational piece of pulmonary rehab is what will have a positive impact on weight management. In our program, we had a registered dietitian who would come in and he would give a lecture on nutrition that patients would find so invaluable that they could take home all sorts of handouts and try to implement those. And so really those two things, the aerobic exercise and then all of the emphasis on nutrition, would be the valuable factor to help a patient with that.
That's really great. Thank you for that answer. Another question, this question is for me, full transparency. Sometimes I feel like, and this kind of goes back to that other question about when should somebody really think about starting in pulmonary rehabilitation. I have some patients who think or say, or even, non-pulmonary fibrosis patients who say, I'm pretty active. Maybe they don't exercise, but they're up and doing. They don't sit around a lot. I'm very active, and I don't think I don't need an exercise program. Don't need to go to pulmonary rehab. How might you counsel somebody who is a mover and a shaker? They do lots of things, but maybe aren't incorporating structured exercise into their daily habits.
That's a great question, Dr. Case. I, in that situation, would emphasize to the patient that earlier intervention equals better outcomes. And that while they are active in their day-to-day lifestyle, there are elements that they will not be familiar with or know unless they are in a pulmonary rehab environment. So just because they are maintaining a decent, moderate level of physical activity in their day-to-day life, it's more than likely that they've never learned breathing exercises. And so they would come to pulmonary rehab and learn those so that eventually when they begin to experience symptoms and all of a sudden, gosh, I've never had a problem with my breathing before, but all of a sudden now I'm noticing difficulties. They'll be able in that moment to implement what was learned in pulmonary rehab rather than, oh gosh, Dr. Case, now I'm experiencing problems. Will you refer me to a pulmonary rehab program? Sure, but the wait list is 2 months, 3 months out. And so now we're just pushing that out even farther. So I would really stress the importance of early intervention equals improved outcomes. Everyone could benefit from this service.
That's great. I'm going to try to sneak in one more question. And that is about, and you kind of alluded to this, but how do you decide about oxygen flow rates for people? Number one, for people who may not use oxygen in their daily life, but they're not doing regular exercise. And for those who are on oxygen, how do you decide what they're going to be using during their exercise activities?
Yes, I'm so glad you asked this question. Thank you. So with supplemental oxygen, another lovely, wonderful reason of pulmonary rehab, it can be really scary to exercise when you're on oxygen and you're not sure, okay, my ordered dose is 2 liters per minute. Well, that's when you're sitting. So the number to remember is 90%. You want to be at 90% or above. You don't need to be at 100%. We know that you have chronic lung disease. We just want that threshold of 90%, that the patient should not be dropping below that because we know that there could be negative effects if you're below the 90%. And so how we know this is that we require all patients to have a pulse oximeter. Those are those things that clip on your finger. You can buy them over the counter at any pharmacy. I highly encourage everyone on this webinar to go get one if you do not have it. And patients will wear that while they are exercising on their bike, on the treadmill, etc. And so from there, we can look and say, you're at 93% on 2 liters per minute. That's perfect. Well, all of a sudden, if we see, now you're actually at 88%, that's how we know, and that's how the patients will learn that you need to titrate your oxygen up. So while 2 liters per minute may be safe for you when you're sitting, when you're exercising, you're engaging more muscles, therefore requiring more oxygen. So 2 liters per minute at rest may be fine, but when you're walking on a treadmill, you need to increase to 4 liters per minute, for example. And so we'll have the patients bring their pulse oximeters as well as their portable concentrator if that's what works for them. More frequently with pulmonary fibrosis patients, they're going to require the e-cylinders. And so this is why I also want to throw in the importance of calling your representatives to talk to them about the SOAR Act so that we can improve supplemental oxygen access, because it can be very challenging for patients to carry multiple e-cylinders with them to pulmonary rehab, because it could be a 2-hour session. And if you're requiring 4-6 liters per minute, you need a couple e-cylinders. So just to summarize, I'd say that pulmonary rehab is the safest place to start an exercise regimen, because the healthcare professionals will teach you when it's appropriate to titrate your oxygen, and you can take that education back home to apply to your home exercise regimen and know, okay, I've got my pulse oximeter, but I'm at 88%. I got to titrate myself up a little bit.
That is a perfect answer. Thank you so much. I think we are out of time. I'm sorry we couldn't get to everybody's questions. We really appreciate all your engagement and involvement today. I actually, Dr. Carlson had several people comment that on their Q&A questions that they were participating or had participated in or were just getting ready to start pulmonary rehab. So I'm very excited that so many people are taking advantage of this service, and hopefully others who are listening today and haven't taken advantage of pulmonary rehabilitation will do so. I do want to thank our sponsors for today, and just remind everybody that if you want to go back to the chat quickly in the moments that we have left and download the PDF of the slides, you can quickly do so. And Dr. Carlson referred to the Supplemental Oxygen Access Reform Act that is currently before Congress, both in the House and Senate. And you can find information about the SOAR Act on the Pulmonary Fibrosis Foundation's website, listed under our advocacy page. So thank you everybody for your participation today, and we look forward to seeing you again at our next webinar. Have a great afternoon.